Welcome everybody. I want to thank everyone for coming this afternoon. We appreciate everybody being here, especially the Westridge Center staff. But also want to thank members of Leadership Council that are here, members of the media for coming, and our CEO, Claudia Fort, for being here as well. So it's a fun opportunity for us to brag a little bit today about Westridge Center. Most importantly, about the incredible staff that's here. It's a privilege that we can gather to celebrate and the most recent National Committee on Quality Assurance recognition that we've all achieved, that you have all achieved. Now, we have a fantastic lunch waiting for us out back, and I know we're all dying to get to that. But before we do, we must first recognize the great work that the Westridge Center team does day in and day out. The most important thing that I need to say today is that the team here, the Westridge Center team, is an enormous source of pride for Rutland Regional Medical Center because of the vital work that you all do day in and day out. 365 days a year, it doesn't stop. And we just need to say thank you for all that you do for our community, for the patients. Without you, it would leave a big hole in the community, so we need to say thanks for that. This is not easy work by any stretch. You provide the tools to help patients succeed, and you do so at an extremely high caliber. Faith Stone, program director here, is backed by an awesome team of clinicians, nurses, front desk folks, security, admin support, many others that I'm not naming, but the Westridge team in collaboration with Kathy, manager, Tammy, nurse supervisor, the leadership team, everybody does an awesome job here at Westridge. So I just want to thank everybody for coming. This recognition is unique, it's important, and it's really just reflective of all the hard work that you all put in. So thank you. And I'll turn it over to Faith to say a few words. Thanks, Faith.
Thank you. So our ability to sustain the NCQA for the past 4 years, it is unbelievable. It's unbelievable. It really does demonstrate our commitment to quality care. But we're not just medication here. We have individual counseling, group therapies, and our collaboration and partnerships with our other community providers, substance abuse treatment providers, with spoke doctors, with primary care physicians, with specialty physicians, with the Department of Corrections, with the Turning Point Center, with Family and Social Services and DCF. All of those collaborations are what help to ensure that our patients' medical needs are met, that we're addressing social determinants of health. This particular 2021 recognition, given the challenges over the last 18 months, is especially meaningful. It just proves that as a team we are unstoppable, and we go above and beyond to support recovery. So over this past year, some of the things that we've been able to accomplish is we've maintained a zero wait list. We've increased our census by 17%. We've adopted a rapid access to medication policy, which means no wrong door for treatment. Knock on our door and we'll get you somewhere. We've continued to provide almost every service available via telemed, and we will continue to support our patients and address their needs both physically and emotionally. I guess all this work wouldn't be possible without supportive leadership, dedicated and passionate staff, engaged community partners, and most of all, motivated patients. So I would like to thank everyone who makes recovery a possibility, and thank everyone for coming out today to celebrate with us. We are beyond proud that you're here. Thank you.
Yeah, sure. Any quick? Well, thank you so much, everybody, for coming. I want to congratulate everybody, especially leadership, CEO, Mr. Claudia Ford, and Jonathan, and obviously, one and only program director, Faith, and the leadership. And it's obviously, it's a teamwork, as Faith said, that it's a teamwork, it's a collective, it's an effort by everyone, literally from security guard to CEOs. Everybody's involved. It's a collective effort. And to get this recognition, it's a big deal. It's a remarkable achievement. It's generally, looking at the background, generally, if you see this word here, this is a specialty. So usually they give this to the primary care people. This is very rare, it's very not often to get this recognition as a specialty clinic, especially addiction. It's a subspecialty even in medicine, even in psychiatry. It's extremely, you have to meet certain, like the whole 60-point score requirements to get this recognition. And let me give you some of these, like literally we have done amazing job obviously by the efforts of everyone. We provide comprehensive care. We really do not just hone on physical health, we also take care of the mental health as well as mental health that includes addiction. That's important. Then we do, if you see this recognition is called patient-centered practice, specialty practice. So we provide patient-centered care. We literally, day-to-day basis, we get tons of emails. Literally, we make this individualized by valuing, by preferences, by choices of the patient, involving their families, friends, parents, etc., etc. Then the most integral part of getting this recognition, the extremely important is the care of coordination of care. We literally coordinate with tons of specialties. We deal with cardiology. Our patients are on methadone, heavy doses of methadone, fentanyl, they are at the risk of cardiac arrest. We talk to the cardiologists, we deal with infectious disease. Our patients are prone to risk of Hep C, cellulitis, FCs, HIV. So you can imagine every specialty somehow, one way or other, they are involved in addiction. We deal with the primary care, we talk to them, we do coordination of care. Literally, it's not really, it's unlimited. Detox centers, community health care centers, primary care, rehab, everybody, ED, our own psychiatry. These folks send us emails for the patients to get admitted there for detox, so that's the coordination of care. And the fourth one is really important, accessibility to healthcare. We provide accessibility, easy access, as Beth said, you don't have to wait forever. We started this, you can see rapid access to medication on Fridays. Dr. Salmons and I, we do clinic telehealth from the offices, and we provide services for Suboxone, buprenorphine. Literally, a patient can be seen on Friday, next morning they get Suboxone. That's really is happening here, just like in Boston or any big metropolitan, Chicago or downtown LA. It's literally happening here. Fifth one, which is extremely important, very close to me, quality of services. We are providing the literally high standards of quality. When I got here last year, we brought the Suboxone induction protocol from Harvard. I brought it here. We adopted here. So the folks around in this community, they are getting the same treatment you get at the MGH or Brigham or Yale in Connecticut, you name it, literally. Same treatment at Columbia, Cornell, or Mount Sinai, New York. It's exactly the same treatment we are providing here. Same protocol. Other day, I got an email from Dartmouth, director of New Hampshire Hospital, it's affiliated with Dartmouth. I got an email, what do you guys do for the methadone? And I showed him our protocol. He was surprised. Oh, you are doing exactly the same what we are doing. So imagine we are doing excellent work here. So, and bottom line, we are providing service. And last thing, it's extremely difficult to work with addiction patients. They are the toughest population literally in medicine world. We lost 90,000 people last year with opioid overdoses. It's extremely difficult patient population. We are losing people literally like right and left. We are losing thousands of people every day. These, if we are, and our death rate, what I'm seeing in Vermont is pretty low. And because, just not because that we don't have fentanyl here. We do have. We have designer drugs. We have crocodile. You can imagine it's a Russian drug. We have here. I've seen it here. We have horrible drugs here. We have less mortality compared to Boston and other areas of New England because we are providing services. We are really doing amazing job. We are engaging people. It's tough. It's obviously tough. I know we always say Jonathan is witness to this. So we try our very best to engage folks in the treatment, that they can survive and they can live longer. So they have their challenges. Addiction patients have extremely, half of our patients are homeless. They are living in shelters, no money, no SSI, no SSD. They are toughest patients. And when you deal with someone who has nothing to lose, literally, and there is a carfentanil outside and fentanyl outside, it is extremely challenging to keep these folks alive in the community. And I think we are doing an amazing job, obviously by the help of everyone. As I said, from security guard to CEO, everyone. So thanks everybody for coming, and once again, congratulations. Now I'm going to, and my last, but not the least, Mr. Clarifor.
Don't make me follow Dr. Ahmed again. I mean, Dr. Ahmed, thank you. Thank you for your service and faith and your enthusiasm and your commitment to this work. It's really pretty amazing for me. I'm not here that often, right? You don't see me that often, but I see you guys. I see the work that you do. Every single orientation class, when I talk to our orientees about our goal of access, there's a number of things I can talk about. I talk about what you're doing at the Westbrook Center every day for some of our most vulnerable patients. And one of the things, I haven't been here that long, I've been here 3 years, a little over 3 years now, and shortly after I came, I had the chance to meet our former police chief, who's now in a statewide leadership office, a tremendous leader from what I've heard, Chief Baker. And one of the things Chief Baker told me was, what a difference Westridge has made to our community. He said, Claudio, when the hospital opened up Westridge, it made a huge difference. You give, at any given point in time, about 400 of our colleagues, our citizens, our neighbors and friends, a big part of their lives back, right? They can be present with their loved ones. They can hold down employment. And it's not just that you do that, what you do. It's how you do it. And that's what this really means for me. You can do the basics and say, hey, that's all these people deserve. And some of these people are the most challenged, and as Dr. Ahmed said, right, and you mentioned, among us. Very easy to take care of privileged people who have means and resources. Very challenging to take care of people who don't have those resources. And it's not just what you do, it is how you do it. And the fact that you have gone over and above to get NCQA certification means you're not doing the basics. You are doing, as Dr. Ahmed said, you are out there with any hospital, any top health system in the country for how you're delivering care and actually at the end of the day, the love that you bring to your patients and how you do that. So I will tell you, you don't see me that often, but I do see you. And I do appreciate the work that you're doing for our community. And it is an essential part of the mission of this hospital and what we do when we talk about how to improve the health and lives of our community. So tremendously grateful for you, and tremendously, this is a great cause. After a tough year that we haven't had a chance to celebrate a lot, this is a great day, and for all of us in leadership to be able to come out and celebrate this accomplishment and all the great efforts that you put, especially over the trying times of the last year, this is a real privilege for us. So I just want to thank you for your work and your commitment to our patients. So congratulations, everybody. Good to be here.
Thank you.
Okay. So Faith, you want to come up here? We printed out the actual certificate of recognition that you've obtained from the NCQA. And this is just, again, a more formal presentation of this and something that we can, of course, display and hang up and take a lot of pride in. So here it is. Thank you, everybody. Thanks so much for coming.